If you've been suffering from neck pain, you know how miserable it can be. But luckily, the right techniques and stretches can really help to alleviate this pain and help you to feel better fast. And that's exactly what I want to share with you in this video today. These are some of my favorite mobilizations and stretches to help improve your range of motion, decrease your neck pain, and help you to feel better fast. But before we jump right into those, let me explain two key concepts that are going to enhance your outcomes with this video, meaning you'll get better results if you understand these two things. I'm going to grab my spine model to explain this. So first of all, he is looking this way. You're looking at the back of the head and the neck right here. As we start to rotate his head, look and see where does the majority of that motion come from early. You'll see that early on, that motion comes right up here high in the neck, and then as we continue to rotate, it starts to twist down here lower. Similarly, with nodding your head up and down, if I were to nod his head down, meaning tuck his chin down towards his chest, you'll see that the majority of that motion is right up here high, and then later on, it comes down further in the neck. So depending on where your limitation is, meaning if you don't have very much motion at all before it gets painful, chances are that problem is up higher in your neck. Versus if you have pretty good motion, but it's painful right at the end, chances are that problem is coming a little lower in your neck. So keep that in mind as we get into some of the mobilizations that I'm going to show you later. It really helps to, again, enhance your stretch, enhance your results. The second thing that I want to point out is if I rotate this skeleton's head over here to the left, so if he's looking kind of towards that direction, which way do those vertebrae move? These vertebrae, they call them the spinous processes, these big bones on the back, they're going to actually move that way over towards your right. And then finally, if we look down, those spinous processes move up. And so the back of the vertebrae move the opposite direction in which the head is moving. That's going to be important because I'm going to show you some mobilizations that might seem a little bit backwards, but if you can understand that that's how the vertebrae move, all of a sudden your results are improved and your outcomes are enhanced. And so that being said, let's get into this. I've got a couple of mobilizations and a couple of stretches that are going to help you with those motions, looking side to side and then looking up towards the ceiling. Those are kind of the three motions that are typically most limited with chronic neck pain. Those are the things that I want to help you out with, and I want to do it right now. The first motion that we're going to work on is rotation, or moving your head like you're glancing from side to side. Tends to get really stuck with people who are experiencing neck pain. Now, the only thing that you're going to need with this is a pillowcase. What I'm going to do is grab the pillowcase at its corners so it's kind of as long as possible on this diagonal. Now what you're going to do is put that around your neck. As I mentioned in the introduction, if you're super limited in this, if you don't have a lot of motion either way, you probably want to keep this up a little bit higher on your vertebrae. But if you have pretty decent range of motion and it just gets a little stuck at the end, you can let it fall down kind of to the middle and lower part of your neck. As I mentioned, the first thing we want to do is mobilize those vertebrae. How you're going to do that is put that towel as close as you can to where the pain point is or where the stuck vertebrae is. I'm going to move my head over here to the left, so I'm rotating to the left, and let's say I got stuck about right here at about 45 degrees. I'm going to keep this left hand down right here against my chest. This right hand, what I'm going to do is try to hook that spinous process. So that bone in the back, we're trying to put that towel right on top of it. Now with my right hand, I'm going to pull in that direction over there. So it's not straight out to my side and it's not straight in front of me. It's kind of at this 45 degree right in this direction. And what you should feel is that towel is right on top of that bone, and you should be able to mobilize it a little bit, meaning pull that bone just a little bit further into this rotation motion. What I would do is go to the end range of your motion, right where it starts to get painful, and then perform about 5 of these little mobilizations in that direction. So as you feel it pulling on your neck, you're going to perform 5 of those. And then what you should find is you should be able to rotate your head just a little bit further into that new range of motion. Again, go as far as you can until it starts to get maybe a little painful till you reach the end of your motion again. And then we're going to perform 5 more of those little mobilizations. So again, my right hand is pulling in that direction, pulling my vertebrae to to rotate it more into this new motion. 5 times, and then I would do it one more time. So now go even a little bit further till the end range, and then you're going to perform 5 of those mobilizations again. That's the mobilization portion. I did that to the left. If you're painful in both directions, which is the norm, which is what most people experience, do it to the right as well. You would just reverse that. So now my right hand's down, and I'm going to pull with my left. And so about 5 mobilizations 3 times each direction. That's your first exercise. But then we're going to follow that up with some stretching. It looks similar, but it's a very different purpose. We're not mobilizing the vertebrae anymore. Now we're just stretching into this new range of motion. If I'm still going to rotate to the left, what I'm going to do is cross my hands. We're still using the towel or the pillowcase. Cross my hands. My right hand is going to grab this left tail and keep it right down here against my chest. Now with my left hand, I'm going to grab the right tail and pull that right up here over kind of my cheekbone right in this area. Now with my left hand, I'm going to pull in that direction over there until I get a rotation through my neck. So we're going to pull and rotate just until we get a good stretch all through that, let's see, right side, all through that right side of the neck. You're going to hold that for about 20 seconds, and you can repeat that one 3 times. Should be pain-free. If you're into a painful range, you've gone a little too far, just back it off a little bit. Stretching should be comfortable. It should be as relaxing as possible, and try to keep it in a pain-free range. I would do that 3 times, 20 seconds over here to the left. Now I'm going to switch my hands up. Now my left hand is going to grab the right tail. Right hand is going to go right on top, and I'm going to use that tail to pull over here into this right rotation in as much pain-free motion as I can. We're going to hold that for 20 seconds, and then we're going to repeat that one 3 times. The other motion that's usually limited with neck pain is extension or looking up. You kind of get to this point where there's this block and it's painful. These are some techniques to help you through that. We're going to grab our same pillowcase, and it's folded on a diagonal still, and we're going to put that right around our neck. Now what I want you to do is a chin tuck. And so you're going to take your chin and you're going to pull it straight back into your throat. So try to keep your eyes level, keep your face level, and it's like someone's smashing your face with a pie. You're kind of going straight back in this direction. But now in order to mobilize, what we're going to do is we're going to perform that motion with this towel. So I like to start up a little higher. Right now the towel is up higher, or the pillowcase is up higher on my neck. I'm going to hold that nice and secure with my hands as I do my chin tuck right over the top of that towel. Hold for a couple of seconds and then return to that starting position. You're going to do 2 or 3 up here high, and then you can kind of lower the towel down a little bit, and you'll feel that we're actually performing that mobilization a little lower on your neck. Again, 2 or 3 mobilizations down there, and then we can drop that towel down low, and then we can do that chin tuck over the top. Again, the goal with this is to just get one vertebrae moving better on top of the other. And that's a great way to do it, is with these joint mobilizations. So, 2 to 3 mobilizations at a couple of different levels up and down your neck is a great way to get those joints mobilized. Now what we're going to do is follow that up with some stretching, just like what we did with the rotation range of motion. We want to capitalize on that decreased pain and that new range of motion, and this is how we're going to do it. Now what I'm going to do is put the towel up here high so it kind of hooks right underneath my head, and then what I want you to do is with your hands, you're going to follow your eyes as you try to look up. And so with my hands, I'm actually giving a little bit of a traction force, so I'm kind of pulling in this direction as I'm trying to look up as high as I can go. Get to the point where you start to experience pain. We're going to hold it there for about a 5 to 10 second count and then come back down out of it. And as you repeat this, what you should notice is you get up higher and higher. Pain decreases as we work into this new range of motion. Again, I'm pulling with my hands to traction my neck. Hopefully we can get into some of this new range of motion with this exercise. So that's your second stretch, but I also like to follow that up with even a thoracic mobilization, or a mobilization for your upper back, to help it to move better as well. Basically, your neck needs to move on top of a mobile thoracic spine, and this is how we get to that. You'll notice that I switched seats. I'm in a chair now. It's got a nice back on it. It doesn't pivot or swivel or move or anything. We're going to extend back over that chair. And so as I'm working into this motion, again, I'm going to get right up here. And now at the end of my neck range of motion, what I can do is extend through my back. So I'm using the back of the chair to extend through my upper back, again, to a point where it's just comfortable. I don't want any pain with this. And then we're going to return back down to that starting position. And that's just a great way to mobilize your upper back and to get it moving better. And you can repeat that one about 10 to 20 times. Hey, if you liked this video and want to see more from Tone and Tighten, hit this circle right here to subscribe to my channel. For some reason, YouTube thinks you might like this video from me right here. Check that out, see if YouTube's right. Again, I hope this helps you to feel better, and we'll see you again soon.